Secretary Hall, I want to talk about the female veterans, the post 9/11 veterans, and the rate of breast cancer there. I've seen some of the data, and those between the ages of 18 and 44 are 34 times more likely to develop breast cancers. So if you would, talk to me a little bit about the outreach that you are doing for female veterans, what you're doing to build this awareness, to make them aware of services that are available, why they need to have regular and ongoing testing, and how they're working with the VSOs on this.
Absolutely, Senator. It's a major focus of mine. As you know, the Office of Women's Health reports directly to me. We are focused on this as a result of a lot of the authorities that you and this committee gave us through the MAMO Act, the Deborah Sampson Act, staffing up our facilities with enough women's health coordinators and clinicians on the front line to be able to meet the needs of these vets. I will mention that reproductive cancers as a category of presumptive conditions will include breast cancer. And so that will help from the standpoint of giving even more veterans these benefits, especially if they were deployed and Mr. Jacobs and his team can find a way to give them PACT Act benefits. In terms of outreach, we are doing very targeted outreach to women veterans. The Center for Women Veterans is very focused on that. Mr. Borsler probably has more details to share on that as well.
Thank you, Senator. There's, in terms of digital ad campaigns, we're specifically targeting different customer personas, including from Vietnam veterans, post 9/11 veterans, but also women veterans that may be exposed to all these toxins as well. And we've seen some significant successes, reached over 42 million just in the recent weeks since the passage of the bill. And we think that obviously for post 9/11 veterans, that digital advertising works very well. We want to make sure, though, that we're also hitting radio and TV and having our facilities out in the field, engaging with as many of the women veterans who may not yet be enrolled in VA. And if you came to VA 10 years ago, come back and try us again. We have the women's clinics, especially, are some of the most incredible programs we see in terms of our trust scores. The fact that women can access the clinics from a different location or different entrance at the hospitals they're incredible. Also, the use of telehealth and virtual health has really enabled, we've seen the trust scores for women veterans in particular that access VA healthcare services really go up quarter over quarter over the course of the pandemic. So we're doing everything we can to increase access and improve outcomes for our women veterans.
I appreciate that. I think that we all know with breast cancers, with reproductive cancers, that early detection is primary. So this outreach and getting our female veterans enrolled is going to be important. I had one other question. The Camp Lejeune Act. We've had so many questions about how about Section 804 and how they're going to deal with the awards from the lawsuits and how that's going to deal with the offsets. And Mr. Jacobs, I think this maybe comes under your jurisdiction. But our veterans, there's a lot of confusion around this with these awards. Can you speak to that for us?
Absolutely. Thank you, Senator. This is a question we're continuing to get, and we're trying to clarify and communicate. There is a lot of confusion. There's also what I've been told is about $1 billion worth of advertising on the lawsuit. So it's top of mind for many. We want to make sure veterans and their family members make an informed choice. We're not going to persuade or dissuade them from seeking justice in the courts, but we do want veterans and their families to understand if they are successful and they receive an award through the judicial system, that award will be offset by the amount of VA benefits they're receiving for their specific Camp Lejeune benefits that they're receiving from VA. So we are not making that determination. We're going to share information with the Department of Justice and the courts, and they will determine the total amount of the offset. And then, of course, the offset will also have to take into account whatever lawyers' fees are part of that, from my understanding.
Okay. thank you for the clarification. I think the sooner you can get us something in writing, the better it will be.
Absolutely. This is a complicated piece of business. I
Yes.
want to make sure it's crystal clear and that it's gone through our council's review, and that we make sure we are clearly communicating so veterans can make an informed choice. And we also want veterans to apply for benefits if they haven't done so, if they've been affected by Camp Lejeune contaminated water.
Thank you. Thank you, Mr. Chairman.